Mistrust and misinformation. Riots on a French Caribbean island against COVID-19 restrictions and mandatory vaccinations. Why are people on Guadeloupe fighting back against injections? And can the government change their minds? This is Inside Story. Hello and welcome to the programme. I'm Rob Matheson. Violence on the streets of Guadeloupe, a French island off the eastern coast of Dominican Republic and more than 6,000 kilometres from Paris. President Emmanuel Macron is calling the situation explosive. Cars and buildings burned, roads barricaded, schools cancelled. Special forces have been on the streets to try to calm things down. It's partly because the government of France says all healthcare workers must be vaccinated against COVID-19. And everyone has to carry proof they've had the injections. But people on Guadeloupe are resisting. They say they don't trust the vaccines, the authorities on the island, or the French government. As COVID infections and distrust sweep across Guadeloupe, can people be convinced they should get the jab? The French Prime Minister has said the government will not back down on its decision to impose the new restrictions. Jean Castex blamed the violence on a small group of people.
C'est une petite minorité violente.
It's a small violent minority that robs stores, blocks roads, holds motorists for ransom, prevents sick people from accessing sometimes vital care, and even shoots at law enforcement. I condemn these acts of violence in the strongest possible terms. The perpetrators are and will continue to be arrested and tried. I also want to express my solidarity with our fellow citizens of Guadeloupe, who are the first victims.
OK, let's bring in our guest. Clemence Apetogbor is a journalist. She's joining us from Pointe-à-Pitre. Jean-Yves Bonnaire is the president of Contact Enterprises. It's a business association. He's in Fort-de-France in Martinique. And from Lagosier, Guadeloupe, Stephanie Melyon-Reinette, who's a sociologist. Welcome to the programme, all of you. Clemence, I want to start with you. What's it been like there?
Actually, I'm in Pointe-à-Pitre, and it's quite calm today after some violence this weekend. But if I say, I was on the field yesterday night with some protesters, and they say that the fight will continue until they have answers from Paris. For the moment, they don't have any answers, so they will continue.
How much is this about not trusting the vaccine? How much of this is about not trusting the government?
Almost everybody that I met, also because they think that Paris doesn't want to hear that they need drinkable water, that they need jobs, that they need some help from Paris. So they are thinking that Paris doesn't want to listen to them. And that's also why they don't want to take the vaccine, because it's a thing from far away from Paris, for the French mainland, but not for the Caribbeans.
Stephanie, how much of this is a distrust of this vaccine, and how much of it is a distrust on Guadeloupe of all vaccines?
Well, I think that the distrust of the vaccine is much more linked to, I would say, the anti-colonial spirit that is, I mean, a characteristic of Guadeloupean people. I mean, more and more since the 1960s, 70s, and even before that, because it's a history cycle that is repeating itself. It's really a redundancy of that part of history that is not solved. And each time there is a crisis, there is I mean, those issues just come back, you know, on the forefront. And I'm not sure that the problem is with the vaccine. The vaccine is, for me, I would say the point, the subject that helps people, I mean, nationalist people, nationalist movement, to voice all the other claimings. because of course there is a distrust because of chlordecone, the poisoning of the soils and the bodies of the people here, because the government enabled that a few decades ago. But the fact is that there is also a lot of misinformation regarding the vaccine and a lot of fake news and fake discourses or unproven discourses. And this is really a lot of beliefs that are amalgamated together, and that makes, that helps, I would say, that prevents better the vaccination campaign to go further here in Guadeloupe.
Just to be clear, chlordecone, if I understand it correctly, it was a poisonous pesticide that was used in banana plantations, and I think that was until 1993, and I believe it was said to increase the risk of prostate cancer. I want to talk about that in a moment, but Jean-Yves, in Martinique, there are similar situations that we're beginning to see in Martinique here in response to the imposition of mandatory injections. Tell me what's happening there.
On the ground, I think we're not as bad as Guadeloupe, at least not yet. And we do hope that we do not reach the level of unrest that we have seen in Guadeloupe. However, last night there was some street riots, but it was contained to a small part of the capital Fort-de-France. There were also some demonstrations throughout the day yesterday. And there are still some barricades on the road, so the traffic is very difficult today. And basically, a lot of people could not go to their workplace, and this is the situation. But not much violence yet, at least not yet.
Clemence, Stephanie was referring there to chlordecone. That's what became known, I believe, as the chlordecone affair. This was back in 1993. It still clearly resonates with people in Guadeloupe. Why is it that governments in Guadeloupe have been unable to regain some sort of trust of the people there since that time?
I think it's because the French government it wasn't that transparent, and it's still the case for the moment, because some of people are still thinking that the government is lying, trying to hold some stuff about the chlordecone and the impact in the environment, on the agricultural fields, on the agricultural workers' health also. And I think that's why it's still a big thing, finally, because some of, even young protesters told me that Paris lied before. So, it's difficult for them to trust Paris today. It's not about vaccination. It's more about Paris, and they are simply afraid to be lied again, I think.
Stephanie, what role is misinformation about the vaccines playing in all of this, do you think?
Well, the misinformation, I would like first to react to what my fellow Guadeloupean said about the chlordecone, and I think it's linked to the issue of the vaccine. The problem with the chlordecone here, it dates back the 1990s, yes, but the 1990s is the moment where when the government finally prohibited the use of this pesticide in Guadeloupe. And it was already forbidden in the metropolitan France since the 1970s. And they knew that it was really harmful to the bodies and certainly could cause cancers in people. This is something that we have seen here in Guadeloupe. We have observed that there is an increase of cancers in women and men, prostate cancer, uterus womb cancer, and as well breast cancer, and as well endometriosis as well. A lot of cases now in Guadeloupe, and the government doesn't recognize the fact that there is a link between the chlordecone pesticide poisoning and the increase of cancers. Only the prostate cancer is recognized as caused by chlordecone because a lot of men worked in the banana plantations. And as well, recently, during the trial, because there was a trial against the government, the association that tried the government was faced with the refusal of the government of the court to go further because of what they say is the prescription, because it was in the 1990s, but we still see the effect of the chlordecone, and we will have the effect for 7 generations. So with that, of course, there is a mistrust now that is higher against the government, the French government, because first they knew for 20 years that people were using chlordecone here in the banana plantation. People eat bananas a lot here. This is, staple food. And as well, a lot of people work in the banana plantations, and they knew that it was harmful. So that's why now people amalgamate the issue of the chlordecone with this, and also the exploitation during the colonial period with enslavement, and saying that their body and they are always exploited, and they can be armed by the French government. That's why they have that mistrust.
I can understand clearly why, as you say, why there is a level of mistrust there. It sounds that there is almost a perfect storm, isn't there? Because there is an existing mistrust of the government. And also, as I was talking about before, we have a wave of misinformation which has been sweeping across the world, we know, but is obviously is still affecting Guadeloupe as well. To what extent is that misinformation and social media playing a role in people's, or augmenting, if you like, people's distrust of the government, of the vaccine?
I think that there are 2 things that we need to consider. The first is, for me, for example, when I speak about the HIV pandemic that has lasted now for decades, since the 1980s, we never saw any physician or researcher or whatever speak on the news if there was not really a finding. They had something that could cure, help, prevent, or help the people contaminated with HIV. Now, the fact that it is so easy now to speak online, to be online and have a say in the political debate and even in the health debate, that everybody just opened the laptop and just say what they want to say. So that's the first thing for me. And the second thing is that people now here in Guadeloupe, they receive a lot of videos from whoever send a video and post a video and saying with that, I would say, anti-government speech. And they make, once again, for me, it's a manner of amalgamate what is what, okay, we have that mistrust here against the government, and people say that governments just kill people. So they will believe that because it sticks with what they already believe. So it's easier to trust whatever comes from outside than whatever comes from the French government.
Jean-Yves, are you finding a similar sort of thing in Martinique? Because obviously that is an island, both these islands, but particularly Martinique is an island that depends very much on tourism. You're part of a business association. The economy is driven by that. What kind of economic impact is this having on people's lives there?
Allow me first to make a slight correction about the chlordecone and where it is found. There's no chlordecone in the bananas, so I want to make that clear. It has not been found there. In the root crops, yes. In the water, and in some fish and crustaceans at sea. And secondly, yes, the impact of what is happening is obviously huge. Tourism is part of our economy here. It's not completely driven as it is, for example, in some neighboring islands where it's predominant. But however, it's an important component of our economies. And clearly, the business community is clearly worried about all of this. We recall that a few years ago, this whole chloroquine story was publicized, and actually it created more harm to the economy. But it is a problem. It is a real problem, and it has to be dealt with. And honestly, it was not dealt with properly initially by the government. I think President Macron acknowledged and made the government liable, but it has to go further, and people need answers.
Clemence, this is really, from what you're telling me, the heart of the problem, in that the people of Guadeloupe, and one would imagine Martinique as well, feel that they are so far distant from the government in France that, if I understand what you're saying correctly, they feel sidelined. They're not feeling listened to. Is there any confidence there, do you think, that France can respond positively to try to fix this?
Actually, I don't know. I mean, when you send police forces, I'm not sure that it's a good answer. Actually, the island is paralyzed, and we need to respond to the situation, because it's difficult now to find gas in service station, to find food in some supermarkets. So it's difficult, it's true. And the situation cannot be acceptable any longer. But I think that they need to talk and to find a real solution, because some cities in Guadeloupe doesn't have drinkable water every day. So there is to respond to that, not to just send police officers.
Jean-Yves, I think you were trying to make a point there. What would you like to say?
Trying to make a point. The issue there, I think, clearly is try to bring, I would say, an instant response to problems that are long-term problems. And it's kind of complex, and I agree with Clemence. Sending the forces and the police may help to control the situation, I think, but it cannot be the only response. It cannot be the only response, because I think the problems are in the heart of the countries, of the territories. And we need to go to the roots.
Stephanie, you mentioned before that this situation was being used by nationalists to draw attention to or highlight the wider social problems, the wider issues that both islands have, obviously in Guadeloupe particularly. But how concerned are you that the tension may be getting away from the initial problem, which is the vaccination rate in COVID? One would imagine that the social problems, unfortunately, still exist, but COVID can be dealt with. Do you think people are losing sight of that distinction, if you like?
Well, I think that this is, I would say, maybe I would have some enemies after when I say that, but I think that there is, this is the problem with the strategy of this movement. Because, for example, if we go back in the early 2000s, in 2009, there was already a big strike, the 44-day strike in Guadeloupe and also in Martinique, against what we call la vicha, la profitation in Creole, which is the fact that we have a very hard time making ends meet here in Guadeloupe, because prices are very high and everything, because we have a lot of taxes, and there is a monopoly, the economic monopoly in between the ends of a very small part of the population, who is incidentally the descendants of the colonizers. So of course that's part of the problem. The fact is, each time they start with I would say a platform of claimings. They have certain claimings. Sometimes we just focus the conversation on a point that is not, I would say, at the essence of the topic. I mean, the initial topic. Here is the same thing. The problem is the vaccination, but it echoes with a lot of the other problem. Of course, it is unbearable that people don't have water here, for example, in an island where there are so many rivers. They don't have water in their tap in many parts of the island, and this is for decades now. And for example, in certain professional categories, people lack, I would say, means to work. So this is the moment for them, for me to hold the government hostage with that situation and ask for them to resolve long-term problems, as our friend from Martinique said a few minutes ago. So of course, it's for me that's why it makes the situation so intricate, because it's complicated to at the moment, in the middle of that crisis, that health crisis that is global. That is, the top priority of the French government, to resolve all those problems. For example, regarding the health issues and the means, the health means that we have here, there is a new hospital that is being built, but in the middle of that crisis with the blockades, I'm not sure that we're helping the hospital to emerge and be. It's not a very practical answer to the crisis at the moment.
I want to bring in Clemence here, because correct me if I'm wrong, but I understand that some medical staff have also been refusing to take the vaccine because they believe it's untested. They don't have they don't know what the long-term effects are. Now that, to me, strikes me as being a fundamental problem in the messaging here, because if you have medical staff who don't essentially trust the vaccine, how can you get anybody else to trust it as well?
Yeah, it's complicated, but actually I have to say that almost 90% of the health workers in the main hospital in Guadeloupe is vaccinated. So it's for a small part of health workers. Anyway, yeah, it's true, but they also say that we took care of our patients at the beginning of the crisis and without the vaccine, so we don't need it now. For some of them, it's the point of view. So yeah, it's complicated, but I think they are also fear, because they heard so many things. We talk about the fake news. And yeah, it's difficult also to be a journalist at this moment, because they said that we don't want to trust you because you are working for the government. We just want to talk with the local TV, and we just want to trust them. So yeah, it's difficult.
Jean-Yves, in Martinique, as you were talking about, we've seen a strike against this. What other action do you think people in Martinique are prepared to take?
I am not sure. We are not sure that the population will follow like the population did in 2009, where the strike was really massive and with a full support of the population, really. Yesterday, general strike started. There were about less than 2,000 people marching and demonstrating in Fort-de-France, the capital. That's very small compared to what happened in 2009. So we're not sure that the population will follow this time.
I just want to come back to Clemence for a final word. We only have a few seconds left. So perhaps in a sentence, how far do you think that the people in Guadeloupe are prepared to go if they feel that the French government and the authorities are not listening to them?
I hope that they will get an answer very quickly, but I think that they are ready to fight, because as we said, it's more than just about the vaccine. It's about fight against poverty, fight for a job, fight for finally to be considered by Paris. And I think for some of them, they are ready to fight until they have answers.
Clemence, thank you very much indeed. I want to say thank you to all our guests, Clemence Apetogbor, Jean-Yves Bonnaire and Stephanie Melyon-Reinette. Thank you very much indeed for being with us. Thank you too for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Rob Matheson, and the whole team here, goodbye for now.